There are many different forms of arthritis. Arthritis means swelling and inflammation of the joints. Now, psoriatic arthritis is a special form of arthritis which is linked to something called psoriasis. So now, psoriasis is a skin disease which affect people mostly in winters and mostly on the extensor surfaces. So there are scaly white lesions that you can see on the extensor surfaces, on the knees, on the elbows, and most of these patients have this during winters. It's quite an itchy rash. Now, if such people develop arthritis, there are specific features that we use to differentiate psoriatic from rheumatoid arthritis. These people are called to have something called psoriatic arthritis. It is important to note that psoriatic arthritis not necessarily happens after psoriasis. So generally what happens is this patient first will have skin psoriasis or nail psoriasis, and then a year or more later, the patient will develop joint pains, might develop joint pains, and such patients might be diagnosed to have psoriatic arthritis. But sometimes it can start together. So the patient concurrently, so the patient might have skin psoriasis and joint pains at the same time. And very rarely, in less than 10% of the patients, the joint pains might occur before the skin psoriasis in a few months or years later. Some patients with psoriatic arthritis don't even have psoriasis, but there is a family history of psoriasis. So it's a special kind of arthritis which can affect the joints of the hands, the back, the pelvis, and it happens mostly in people who have a skin disease called psoriasis. Other inflammatory arthritis, psoriatic arthritis will have joint pains, joint swellings. They may have early morning stiffness. A special feature of psoriatic arthritis is that they may have swelling of the entire finger. We call it a digit. That is called a sausage finger. So if your entire digit or entire finger is swollen, not the specific joints, you might find that they have a small lesion of skin psoriasis somewhere, some lesions on the nails that point to psoriasis. So the patient will think that he or she has arthritis. He will not come with psoriatic arthritis as the diagnosis. So it presents mostly like an arthritis, like rheumatoid arthritis, where there is involvement of the joints of the hands, elbows, knees, ankles. In addition to this, in what is not common in rheumatoid arthritis is back pain, but psoriatic arthritis can present with back pain also. It can present with something called uveitis, which is redness in the eye, inflammation in the eye. There are nail changes. So if you see nail pits and there is destruction of the nails, if you are a keen observer, you will be able to notice that these are psoriatic nails. And if the patient presents with joint pains and you do the certain tests that rule out rheumatoid arthritis, you will be confidently able to make a diagnosis of psoriatic arthritis. Psoriatic arthritis, again, it's an autoimmune disease. So there is no specific cause for psoriatic arthritis. Psoriatic arthritis most commonly seen in males, more than females. Although there are some studies which say there is no gender difference, not much, but in practice we see more in males. And the age group is generally young to middle age, not very old people, but around 30 to 50 is the age group of psoriatic arthritis. And people who have a history of skin psoriasis, obviously they should keep looking out for joint symptoms because they can develop psoriatic arthritis in the future. Again, family history is very important. So autoimmune disease, as I said, there is no specific cause, but if you have if you have a family history of psoriasis, that means the patient's family member has psoriasis, father, mother, brother, sister, or psoriatic arthritis, there is a high chance that you might also develop psoriatic arthritis. Or if you have those symptoms, there is a high chance that you also have the same disease. There are some genetic predilections also which are being studied, but there is no 100% correlation. So there are some genes that you can test, but that does not mean that if that gene is positive, you have psoriatic arthritis, and the vice versa is also not true. That if the gene is not present, you will not have that. So psoriatic arthritis is in a way interesting because there is no clear-cut single test to diagnose psoriatic arthritis. In fact, it's notorious in the way that the tests of rheumatoid arthritis may be positive in it. For example, rheumatoid factor and anti-CCP may also be positive in psoriatic arthritis, but the patient still does not have rheumatoid arthritis but has psoriatic arthritis. So it's interesting to note that psoriatic arthritis, you have to have a very good clinical suspicion, and you need to be a very sound rheumatologist to diagnose psoriatic arthritis. Yes, there are X-ray changes that differentiate. So X-rays of the hands, for example, that differentiate rheumatoid as well as psoriatic arthritis. There is involvement of spine in psoriatic arthritis that differentiate from rheumatoid arthritis. The changes in the spine are different in psoriatic arthritis and ankylosing spondylitis also, which is a closely linked disease. The nail changes, as I said, give you a clue towards psoriatic arthritis. And obviously, a thorough clinical history and examination where you find a skin psoriasis lesion in a patient and the patient presents typically with symptoms of and signs of psoriatic arthritis, you'll be able to diagnose. But it's thoroughly a clinical diagnosis, and many lab tests fail to diagnose it. The good thing about rheumatology is that the diagnosis does not matter much when you are treating these diseases, because most of these diseases respond to disease modifying anti-rheumatic drugs. So just like rheumatoid arthritis, there are psoriatic drugs that work in psoriatic arthritis. There are some drugs that which we avoid in psoriatic arthritis because they are known to exacerbate skin psoriasis. For example, steroids are commonly used in rheumatic diseases like lupus and rheumatoid arthritis. But steroids in psoriatic arthritis may actually lead to a flare of skin psoriasis. We avoid using them, or we use them in a very low dose if the patient is in a lot of pain. If the patient does not respond to these drugs, then we move on to higher drugs, which are now called biologics, and they are quite effective in psoriatic arthritis patients. Anything that affects the skin is very troublesome for the patient because that is what we show to the world. Now, if a patient has psoriasis on the hands, on the elbows, the patient will wear full sleeves clothes, will always be conscious in social situations. So, psoriatic arthritis, because of the skin psoriasis component, leads to a lot of social stigma and leads to a lot of discomfort for the patient when the patient moves about. So that is one social complication. I see that people get very uncomfortable around other people. The second thing, like rheumatoid arthritis, it can cause joint deformities, and in psoriatic arthritis, it can be very destructive. In fact, something called arthritis mutilans, in which the joints get destroyed so much that your fingers can become smaller. It can Psoriatic arthritis, interestingly, has been linked to osteoporosis now, to fatty liver disease, to cardiovascular disease now. If it affects the eye, it can cause inflammation in the eye, which can ultimately lead to blindness. If it causes problems in the spine, it can lead to fusion of joints in the spine. So, like other arthritis, psoriatic arthritis affects the joints mainly and can cause joint deformities. But if it starts affecting other organs, it can lead to many complications. There is no sure shot way of preventing psoriatic arthritis. Like in other rheumatic diseases, smoking is something that triggers all kinds of arthritis and autoimmune diseases. So, if you are a smoker and you've been diagnosed with psoriatic arthritis, please stop smoking. There is a family history of psoriatic arthritis, and there is psoriasis in the family. If you smoke, you have two risk factors there. One is family history, and the other is smoking. So you should, anyway, smoking is not a good thing to do for anybody, but it triggers many autoimmune diseases, including psoriatic arthritis. It's an autoimmune disease, so if you have it, you can't do much about it because there is no specific cause for it. You cannot stop it, but you must keep exercising so that your joints don't become deformed. You should take a good, well balanced diet, avoid alcohol, avoid smoking. You should look out for comorbidities. That I said, it can lead to osteoporosis. It is also linked to fatty liver, to heart disease. So, to have a healthy lifestyle, to maintain your weight, that is all you can do. And obviously, you have to continue your drugs like in any other autoimmune disease. the therapy is long term. Many patients come and ask me, Doctor, when will my medications be stopped? And I have to explain them on the first visit only that yes, they will decrease, but please do not ask me this question, because most of the times we are unable to stop the medications, and people who stop the medications do harm to themselves, because as I said, it is some, all these diseases are demons, which if they are put to sleep, they should be at sleep, and you should keep the drugs going on so that they do not wake up again.